It's Lynda Lippin, and this is the video companion to my ebook on Pilates fundamentals to eliminate back pain. This is 6 simple exercises that basically, if you can perform them both morning and evening for a period of 3 weeks, 3 full weeks, you should see a significant decrease in your lower back pain. These exercises work for a variety of reasons, most importantly because you're working on stabilizing your pelvis and your lower back, strengthening your back, and getting more rib cage and shoulder movement in your breathing, all of which will help eliminate unnecessary lower back movement and therefore help with pain, because more stability for the lower back equals less pain. Now, if you haven't seen a doctor for your back pain, you need to do that. I'm an exercise professional, so the advice that I'm giving you is for somebody who has been cleared by their physician to begin some kind of exercise program for their back pain. So don't try this if you haven't already seen your physician and know that you can exercise and move. So I'd like you to start by lying on your back. And you're just going to be on your back with your knees bent, feet hip bone width apart, arms down on the floor. And you're going to start with something called conscious breathing. And all conscious breathing is taking deep breaths in and out, trying to get as much movement in your rib cage as you can. So I ask you to start with the belly breath, really getting your stomach to move as you breathe in and out. You can even put your hands on your stomach and feel it move. Then you're going to bring your hands to your rib cage, and you're going to breathe there. And as you breathe into the ribs, you really want to try to get them to move. So the ribs move to the side, towards the back, and up towards the ceiling. Then you're going to move towards your chest, really trying to get the breastbone to move as you breathe. And then ultimately you're going to try to get the air in your whole torso, whole rib cage from your waistline to your neck. The lungs are under the ribs need to move when you breathe. It's important for the health of your spine. The other thing that happens when you're breathing properly is you'll feel your abdominals work. So notice, without moving my lower back, I'm getting movement in my rib cage and my waistline. So on each exhale, consciously squeeze the muscles of your pelvic floor a little bit, like you have to stop going to the bathroom, as you're pulling your ribs in towards your waistline. And you're breathing in through your nose, out through either your nose or your mouth. Now, adding to the conscious breathing, which I do want you to do these with your arms by your sides, but I'm putting my arms up so you can see what my hips are doing. You're going to go in for some pelvic rocking. So with your pelvic rocking, as you exhale, you're going to tuck your hips back and let your lower back flatten. The abdominal muscles are just pulling in and down, not hard and tight. And as you inhale, you're going to drop your butt down, push your hip bones forward, and let the lower back arch so that you actually have a space, big space under your lower back. And then you're going to close that space, dropping the hips back. You're going to open that space, pushing the hips forward. And you're going to go through this a few times here. So each of these exercises you're doing around 10 to 15 times. And you're doing this ultimately to find middle ground so that you're in this nice neutral spine where your hips and your pubic bones are in the same horizontal plane for your pelvis. Your lower back isn't necessarily on the floor, but it's not forced off the floor either, and your back is just in a natural curve. There's more on this in my pelvic stability video. From this position, we're going to move into an abdominal curl. So I'm going to have you take your fingers, clasp them, and put your hands under your head. And with your hands under your head, the first thing I want you to do is nod your chin towards your chest and lift your chin up. And you're just going to do this a few times, nodding and lifting. And you can do this with the hands under your head. If it's not comfortable, you can also do it with your arms by your sides. But it's simply the sense of just nodding the chin and lifting. And then you're going to take this into a nose circle, just trying to loosen up the muscles around the base of your skull and your neck. And then you're going to nose circle in the other direction. Now it's important here, as we go to move, that you keep all of that muscle engagement that you had here during the breathing and the pelvic tilting. Now I'm going to take my hands, put them under my head, let my head sit in my hands, and on my next exhale I'm going to nod my chin a little bit, and I'm going to start to curl my upper body up. Now, what I want to be thinking about here is I want to try to keep my tailbone down, my abdominals pulling in, and I'm thinking about pulling my rib cage towards my hips as all my pelvic muscles pull in and up. I'm trying not to pull forward with my head or let my head hang back too much. And I'm going to come back down. So again, for this one, the chin nods. The head curls up a little, and then the ribs start to curl towards the hips. You then make sure the tailbone is down, the pelvis is nice and neutral, the abdominals are in, that you're not straining your neck, that you're really working here. Take a few breaths while you're here, really scooping that belly in on each exhale. And again, you're going to repeat that entire series 10 to 15 times. Bring your arms down by your sides. And now for some arm circles, you're going to lift those arms up to the ceiling. Keep your rib cage pulled into your waistline. You're going to send your arms back overhead. Not so far that your ribs lift up, so you're going to be cognizant again of the abdominal work and of the length of your spine. And then your arms are just going to circle out to the side and down. And you're just going to do this a few times, again being very aware of what's happening in the rest of your body. So note, I'm trying to move my arms, my shoulders, my collarbones without any movement in my spine and my ribs, and then I'm just going to reverse that circle. Again, what I'm feeling for here is that I'm not tucking my pelvis under to do this. It's going to make it very difficult. I'm going to have strain in my neck. I want that heavy tailbone. And with that heavy tailbone, I want to make sure my ribs aren't lifting towards the ceiling. After this, you're going to roll right onto your stomachs. And we're going to have 2 exercises on the stomach for strengthening the back. First, you're going to rest your forehead on your hands. You're going to get your legs close together. You're going to squeeze your butt a little bit, push the hips and the pubic bones into the floor. You're going to breathe in this position, keeping your abdominal muscles in. And we're going to do something called prone hip extension. So you're going to keep both hips pressing into the floor. And without any other movements in the body, you're just going to lift one leg up, reaching it behind you. And you're going to put it down.
And then you're going to do the same thing with the other leg and put it down. Now what's important here is as you're lifting one leg, the other butt cheek still stays a little bit active, so the other leg is still supported. I don't want to completely let go because it's going to shift my hips over. I want you to stay long so that you're not just tightening your back and shoving everything up. You're really using your glutes, you're keeping your abdominal muscles in, and you're really working through the back of the leg, the butt, and you're stabilizing through your abdominals and your lower back muscles. You can also take this into both legs lifting, same kind of work. And then something called flight. You're going to bring your arms down by your sides, palms down to the floor. Pressing the legs down, pressing the hips and the pubic bones in gently, a little bit of squeeze of the butt, and your head comes up a little, your chest comes up a little, and you squeeze your shoulder blades together like crazy and you lift your arms. And you keep your arms reaching back and your head and chest reaching forward and your legs down. And you breathe. And you just repeat that. And then if you wish, you can also add a little leg lift here and do the entire back. And that's it. Those are your 6 exercises. So again, we went from breathing, pelvic rocking to stabilize the lower back, abdominal curling to start getting the abdominals working in a little bit of upper body flexion, some arm circles to start just loosening up the neck and the shoulders, and then some prone hip extension and flight for the upper body extension in order to get the back extensors working. If you saw what I was doing, you'll see these movements are pretty small, they're pretty gentle, they're pretty doable by the majority of people. So I hope you enjoy this series. I hope this helps the book make a little more sense for you if you were a little confused about the wording on some of the exercises. And most importantly, I hope that in doing this you get some alleviation of your lower back pain. Have a great day and thanks for joining me.